Let's get going. Okay, hopefully you all took the last quiz. Should have been pretty easy. It wasn't meant to not be hard. It was meant to boost your grade a little bit. We're gonna move into our last unit. We're almost done. So we have the reproductive system. We're gonna talk about the female reproductive system today, and then we'll talk about the male reproductive system on Monday. And then you'll have the rest of basically the next 2 weeks to get anything else finished that you need to get finished. Yeah, so let's get going. Let me find my colored pencils. So like I said, we're going to start with the female reproductive system. I have posted pictures if you are interested. They're online. If you are not interested, that's fine also. Let me share my desktop here. Maybe it's working. All right, here we go. All right, so we're going to go over some of these words, and then we're also going to go over the female reproductive system. We'll start with just the abbreviations, and then we'll do the female reproductive system. And then next time we will go over the male reproductive system. And then you will have learned so many things this year. All right, cool. So abbreviations, that's where we're starting. I need to grab something to write on. Okay, so DRE is a digital rectal examination, okay? Digital rectal exam. And digital is meaning finger digits, not digital like technology, digital. They can do this, they do this especially to look at in males. They can look at the prostate gland. This way there's a variety of different things that they can palpate, they can touch through inserting their finger into the rectal region. So that's what that is, and it's a diagnostic tool, okay? In the last unit, we talked about how males with urology. Urology was the study of the excretory system, the urinary system, and the male reproductive system. And as we talk next time about the male reproductive system, we will see that they are interconnected. Whereas with females, there's a different doctor that studies the female reproductive system because they are two separate, they're not interconnected. So the female reproductive doctor is a gynecologist, GYN, or either capital or lowercase, is a gynecologist or gynecology. Okay, you've maybe heard of an OB-GYN. Okay, OB stands for obstetrics, which is pregnancy. I didn't spell it right. Obstetrics. Well, that was bad. I'm so sorry. Okay, so an OB-GYN is someone who specializes in the female reproductive system and pregnancy. Okay, so obstetrics is pregnancy. And like childbirth, and then gynecology is just the female reproductive system. All right, L&D is a department in the hospital. It is labor and delivery. Of course, talking about pregnancy. Labor is the act of giving birth, and then or the process before actual birth, and then delivery. LMP is last menstrual period. And we'll talk about the period or menses or menstruation here in just a few minutes. They're looking for your last one. Most females will have a period every 27 to 31 days or something like that. We'll talk about that. NB is newborn. Little babies, newborn. Peds, you've heard before, is pediatrics. This is somebody who treats from when the baby is born to 18 years old. Okay, that's pediatrics. Once you turn 18, you will then go to some form of a family doctor, but when you are growing up, you go to someone who specializes in the developing body, basically, and they are called a pediatrician, right? All right, PMS is for premenstrual syndrome, and we'll talk about that also. I guess we'll talk about it now. A woman's monthly cycle has different parts to it, and during certain parts of the cycle, there can be a variety, because of the change in hormones, there can be a variety of symptoms that happen, including tiredness, depression, anxiety, irritability, cramps. There's a variety of things that can happen. We'll just talk about this now because we're here. So this is called the menstrual cycle, and I wish you could see this entire thing. Probably could find a picture of it. Okay, the menstrual cycle is about average 28-day cycle, and it's divided into different phases based on what's happening in the ovary. Okay, so something interesting about the female reproductive system is that you know that females produce eggs and males produce sperm. Males produce sperm their entire lives, okay? Until the day they die, they produce sperm. Females are born with all the eggs they will ever have. So in the fetal stage, when a baby is developing, I lost my page. The eggs are being created, and they are going through the first part of mitosis. Okay, so they go through the first part of mitosis in the uterus, and then the cells arrest or stop cell division when the baby's born. Okay, at that point, all the eggs are just in the ovaries. Women have 2 ovaries. We'll talk about those in just a minute. And they are born with all the eggs they will ever have. And then when they go through puberty and they begin their menstrual cycle, they will begin to have the eggs will then finish fertilizing. So this is an ovary. Okay, it's not very clear. Okay. And you can see, so they'll go through a series of developmental phases, the egg does, every month as it goes through the menstrual cycle. So one egg will go through the cycle. It will then rupture, okay, during ovulation, and the egg will travel. We'll talk where it travels in just a minute. Some women can feel ovulation, some can't. But one egg every month, this process happens. If the egg is fertilized, then a pregnancy can form. If an egg is not fertilized, then menses will happen, okay? So throughout this 28-day phase, you can see that these are hormones up here in this top section and this middle section. These are hormones, and you can see the hormones are changing, okay? LH, luteinizing hormone, right? Luteinizing hormone has an effect on the egg. That's why it peaks at ovulation. FSH, remember, follicle stimulating hormone. Estrogen, inhibin is another one, and progesterone are all ovarian hormones. They're produced by the ovaries. And you can see how they fluctuate during the menstrual cycle, okay? So look here, we're looking at what happens to the egg. We have hormones here. At the bottom here, if I can scoop this up a little bit, this is the uterine wall. Okay. You can see there's basically 3 phases here. Menses is the phase where the uterine wall sloughs off, and then that is what we refer to as your period. And then the uterine wall will build up over the other basically 24-ish days. When the egg travels to if the egg is traveling, if it is fertilized, It will embed itself in this the secretory phase right here. It will embed itself in the uterine wall. And if there's an egg embedded in the uterine wall, it will stop menses from happening. Okay. The last thing, the bottom portion on here, is body temperature. Okay. After ovulation, a female's body temperature will act. It's not a lot. It's not a huge raise. It's not like you're going from like 98.6 to 105. But there's a small raise in body temperature during this, and then during menses, your body temperature will drop slightly. Okay, so if somebody has PMS, it's usually at the end of the secretory phase and during, it can continue on during menses. But this is how the menstrual cycle works, and all of it is based on hormones. So the different hormone levels fluctuate, and that will determine what's happening to the uterine wall. All right. STD and STI, I lost my pen, is a sexually transmitted disease or sexually transmitted infection. Okay. There are a large variety of these, and they are transmitted, okay, sexually. That's why where they get their name. Some of them you have forever. Some of them can be cured. Some of them you don't know you have. So there's a wide variety of different STDs or STIs. You've heard of a variety of them, I'm sure. All right, the last one, VBAC. So when a woman gives birth, there's two options. She can either do a vaginal birth where the baby comes out the birth canal, or a cesarean section or a C-section, just cesarean section. Once a woman has had a C-section, it is more risky to then the next child have a vaginal birth. So once a woman has had a C-section, generally they will have C-sections for any additional births because of the change in the body caused by the cesarean section. You can have a child vaginally after a cesarean section, and if you do, that's called a VBAC, which is a vaginal birth after C-section or cesarean section. Now they just have to watch it a little bit more closely to make sure that everything goes okay. Okay, let's do think of what I want to do here. Okay, let's do the prefixes here and the suffixes, and then we will talk about the reproductive system with the female. So ectop is out from or out of place. So normally, okay, there's something called an ectopic pregnancy. They are not viable. They won't go to term, basically. Usually, okay, the pregnancy will happen here within the uterus, okay? What could happen is that the pregnancy could get stuck in the fallopian tubes, which we'll talk about in just a second. Hold that low enough. Or they can also be actually on the outside of the uterus, and we'll talk more about that in just a minute. Like I said, not viable. The development, the pregnancy has to happen where it's a safe place where all the nutrients and everything is needed, and that happens to be here in the middle. Okay, meso is middle. Natal is pertaining to birth. Not birth, wow, okay. So the word neonatal, neo means new. So neonatal are right after birth, right? It's a new baby that just was born. So they have like the neonatal NICU, that's the NICU, one of the NICUs that we talked about. where babies who are premature will go there and get extra care. Okay, partum is birth or labor. So you maybe heard of some women who develop postpartum depression. Okay, that's after, post is after. So after birth, they'll get depression after birth. It's actually a really common thing. Phylaxis we've done before, I'm pretty sure. It means protecting or guarding. Okay, and tosia is labor or birth. Also, this one we've actually already done tos before. We did oxytocin, right? So tosia is just a condition of labor or birth. All right, and at that, we are going to move into the female reproductive system. Female reproductive system looks like this internally. I'm going to show you a couple pictures if I can find them. Here we go. So here is a colored version. Eventually you'll be able to see it. Ah, there it is. Okay. You can see the different parts. This is very good to see that you can see right over here, right there, how the ovary and the fimbriae don't actually touch. That's important. We'll talk about that in just a minute, but this picture does a really good job of showing you that. Okay, here's a side view. Whoops, the camera's falling. This delayed camera is really driving me crazy today. So here's a side view. You can see here's the ovary. Okay, here's the uterus. You can see the bladder right here, and how there are two completely separate pathways that lead from the uterus and the bladder. Okay, males, it's going to be the same pathway. Females, they have two different pathways. Okay, and then there's the external genitalia for a female. Oh, gosh, it's driving me crazy. Okay, which you have the labium. You have a labium majoris and labium minus. There's the hymen. There is where the urethra enters. Okay, and then the clitoris. We'll talk about that. All right, so here are the main parts of the female reproductive system. So we have the ovaries. Okay, clearly very important. The female reproductive organ, it produces hormones. That's where the eggs are stored and then released each month. Most women have two. Okay. There are two root words for ovary. Ovaries are filled with eggs, and egg is OO, just like the best. Let me find I lost my pen here. Oh, where is my? Yes. OO is egg. So, for example, oogenesis. OO is egg. Genesis is creation, right? So this is the creating of eggs. Oogenesis. So where the eggs are stored, okay, is the ovary. So OO40 is one of the ovaries. Ovary. Okay. The other ovary is ovario, which is nice and easy. Ovary. Okay. Ovarian cancer, right? They can do an oophorectomy when they surgically remove an ovary. Usually after ovarian cancer, they would do an oophorectomy. Oops, that's in here. Okay, surgically remove the ovaries, right? Okay, so that's the first part, ovaries. Okay, the ovaries have basically these stalks that attach them, so they're not just floating. We're not going to learn a name for those, but just realize that they're not just floating in the pelvic cavity. Okay, next we have what's called the fimbriae, and I showed you that picture that showed you these are actually not connected. The end of the fallopian tubes, you have the fimbriae, and this is where the egg, when the egg is released each month, okay, during ovulation, the egg is released, and it actually has to float and find its way to the fallopian tube. So it's a very small space it's moving across, but there is a space between the two. Okay, this is one reason why some type of ectopic pregnancies can happen. The sperm has made it there, the egg is fertilized, but the egg can actually attach to the outside of the uterine wall. Eventually you'll be able to see where I'm pointing, instead of actually inside where it's supposed to be. Okay, this is fimbriae. No root word for you to know on this one. Okay, the fimbriae attach to the fallopian or the uterine tubes. Okay, fallopian uterine tubes. The egg will travel through the fallopian tube. Okay, if you remember a long time ago, we learned the eustachian tube, and we learned the root word for it just meant tube. Think about just a second if you can remember the root word for the eustachian tube in your ear. Okay, it is salpingo. Same root word here. Salpingo just means tube. Salpingo. So it applies to multiple things. Okay. The fallopian tubes, oh sorry, the fallopian tubes enter into the uterus. Okay, so we have the uterus. The bottom 1/3 of the uterus is called the cervix. So during childbirth, they look to see how dilated the cervix is. The cervix is the bottom portion of the uterus. So this top 2/3 basically, this is the uterus. There's a few root words for uterus. We have utero, that's nice and easy. Hystero, which you maybe heard, some people have a hysterectomy where they have the uterus removed, especially with uterine cancer. And then also metro means uterus. So all of these words mean uterus. I'm just gonna do it right here. Uterus, 3 root words, utero, hystero, and metro. Okay, and then the bottom portion of the uterus is called the cervix. No root word you need for that, so just know that it is called the cervix. Okay, and then the last portion of the internal section of this is the vagina. There are 2 root words for vagina: vagino and colpo. Can't see that already. I'll just get that down a little bit. internal sexual characteristics. Okay, let's do a couple of words. This is not the right paper on this. Okay, so we had hystero, that was uterus. We talked about a hysterectomy. Hysterectomy, okay, to surgically remove the uterus. That will happen with uterine cancer. We also had metro, is the uterus. Metrorrhagia, would be a flow of blood, extreme flow of blood from the uterus. And utero is also uterus. Uterine cancer, I'm sure I have another word for that one. And then we have the vagina. Okay, vaginitis is an infection in the vagina. We also had colpo, which is on the back side. When they do a exam, they'll do a colposcopy, which is different than a coloscopy, okay? Coloscopy is to look at the colon. Colposcopy is to look at the vagina, so that's a very different process. Okay, so that's the internal anatomy. A few portions with the external anatomy. The vulva is the opening from the vagina out, and the root word for that is two. There's two root words for that. Either vulvo, which is nice and easy one there. Vulva, that's the opening from the vagina to the out of the body, vulva. And then also apesio is also vulva. Sometimes at childbirth, so the baby is going to pass through to the world through the vulva. Okay, so the vulva can stretch to a certain extent, but sometimes the baby's either head or shoulders are too big, and it actually can rip the vulva. And so they'll have to go in and stitch it back up. So to prevent that, in many pregnancies, they'll do an episiotomy. Okay. Which is where they go and surgically suture, or not surgically suture, surgically cut, basically, the vulva to be a larger hole so that the baby doesn't rip the vulva. Okay. I'm trying to think what else is. We have just a few more here with the female, and then we'll be done. So we've already learned that gyneco is woman, so gyno is also woman. Gynecologist, woman. Okay. Estro is also woman. We talked about estrogen. Okay, we're actually going to cross. That's not part of the moving that one off. So cross off Heimer. I want to do that one. Okay. So we talked about some of the secondary and primary sexual characteristics. The other portion of the sexual characteristics, the secondary sexual characteristics of a female is the breast. So there are mammo and masto, both mean breast. So women, as they get older, they will get a mammogram. Where they go in and they record, they take actual pictures of the breast to make sure there are no lumps. Masto, if a woman has breast cancer, they will do a mastectomy. They can do it one or both, remove one or both of the breasts to prevent cancer from spreading. And also, I guess it's not super common, but it's common. So we know that one of the functions of the breast is to produce milk during, and we already know lacto is milk, right? We learned that one already. During or after childbirth. So once the baby is born, then the breast will begin producing milk, and that's because of prolactin, remember that hormone we talked about, PRL. What can happen is that they actually can get an infection in the breast during breastfeeding. It's called mastitis. I've heard it's horrible, but that's what mastitis is. It's an infection in the breast, and it's because of, it's caused by breastfeeding. It's not super common, but it does happen. Okay, last one we're gonna do today is meno. Meno is menses or menstruation. And that's that whole process we already talked about. Okay, due to a variety of things, including diet, activity level, body weight, there's a variety of things that can lead to it. Sometimes females will not have a period, not have a menstrual, they won't have menses basically. That's called amenorrhea. So flow, right, menstrual, and no, so no menstrual flow. You can also have dysmenorrhea, where you either have an abnormal, you can have an abnormal menstrual flow. Okay, there's a few more on here that kind of deal with both men and women. We'll talk about those next time. This was all of the women's stuff, okay? Like I said, next time we will be going over the male reproductive system, okay? Does anybody that is on here